perform the testing. So that caused some delays in the testing, several days to get the testing. So as more and more laboratories were able to offer the testing, as more vendors made it available in their instruments, so more and more labs can now do the testing, and that greatly reduces the turnaround time. That is the time for the provider to get the lab result. So likewise, here at Samaritan, we're able to bring the test on Thursday. So we are doing it in a limited fashion because we still have a limited number of the testing kits to perform the test on the instrument. So we're rolling it out with specific patients. So they would be inpatients, certainly our residents from long-term care that may need the testing, healthcare providers or healthcare staff, and emergency room patients would be candidates at this point to have that testing done. Now, certainly the benefit of the testing is because it's rapid in the sense of the time in the lab on the instrument is about an hour. So that's very important on a couple of fronts. One, that the patient would be able to get the result provider fairly quickly, because obviously a patient that would be trying to rule out whether they have COVID, as you can appreciate, they might be on quarantine. So this gives them the opportunity perhaps not to have to be in quarantine. The other aspect, especially on the healthcare side, is the PPE. So you've certainly heard about personal protective equipment, PPE, and trying to conserve how much PPE we use. So this is another aspect of patient flow and our PPE usage. So if we're able to provide faster turnaround for our patients, that also helps our healthcare team. So our phlebotomists, respiratory therapists, nurses, providers are using less PPE. So that helps conserve that as well. And certainly, again, for the turnaround time, we'll call the patient disposition, whether the patient gets sent home, whether the patient needs to be admitted. So having that information is very important, especially to have it in a much quicker time than prior to doing it in-house.